Groups in Crisis and Maladaptive Disorders. Module 1, Foundations of Crisis. In this module, we'll define what a crisis is, explore how individuals experience crisis differently, and identify nursing priorities aligned with NCLEX expectations. Understanding crisis foundations helps nurses respond safely, therapeutically, and effectively. Crises are commonly categorized into three types. Developmental crises occur during normal life transitions such as adolescence or aging. Situational crises arise from unexpected personal events such as illness, job loss, or relationship changes. Traumatic or adventitious crises result from extraordinary events such as natural disasters, violence, terrorism, or mass casualties, and often affect large groups or communities. Individuals respond to crisis and trauma in different ways depending on the intensity and frequency of environmental stressors. Two primary trauma response patterns have been identified. Highly intense episodic environmental activation occurs in approximately 30% of individuals in crisis. This pattern is associated with single, overwhelming events such as natural disasters, violent assaults, or catastrophic loss. In contrast, low-intensity but high-frequency environmental activation affects about 70% of individuals in crisis. These repeated ongoing stressors, such as chronic instability, repeated losses, or persistent threat, have a cumulative harmful effect and are believed to account for up to 90% of the symptoms seen in post-traumatic stress disorder. The biological dose-response model explains how stress affects individuals based on the magnitude and duration of exposure. The greater the intensity of the stressor and the longer the exposure, the higher the risk for physiological and psychological dysregulation. Prolonged or repeated stress can lead to alterations in the hypothalamic pituitary adrenal (HPA) axis, disrupting cortisol regulation and the body's ability to return to baseline. These biological changes help explain why chronic stress exposure increases vulnerability to trauma-related symptoms and maladaptive responses. An individual's response to crisis is influenced by personal coping skills, prior trauma, social support, cultural beliefs, and available resources. What is manageable for one person may be overwhelming for another, making individualized nursing assessment essential. NCLEX-priority nursing care during a crisis begins with addressing immediate physiological needs to support life, followed by ensuring safety, stabilization, and emotional support. Thereafter, nurses assess risk for harm, provide calm and structured communication, help patients regain a sense of control, and connect them with appropriate resources. In crisis care, nursing actions are guided by the patient's perception, coping capacity, and safety needs. Early recognition and therapeutic intervention can prevent maladaptive responses and promote recovery.